Good evening, everyone. So my name is Arbel and welcome to my YouTube channel. Different from my first vlog, so I'll be talking about acute myeloid leukemia. So I've been very hesitant to talk about this ever since because it's not that easy. Um, Even though how much effort you want to put into not getting into the emotions, involved. But we'll take it easy and so we'll start with the definition of AML, or acute myeloid leukemia. So that's the cancer of the blood forming tissue in the bone marrow. That's what my brother is currently fighting, right? He's been fighting this since his diagnosis last February 2019 this year, but the symptoms actually showed up last year. Uh, Started with sore throat, fatigability. So he's complaining about getting tired easily and having these headaches and series of chills and fever. Um, the first time he was rushed to the hospital was when he woke up early in the morning around 4 a.m. and he just passed out, right? And then he was um, rushed to the hospital in the Eastern Visayas Medical Center in Leyte. Um, and then he was initially diagnosed with how was that, anemia, right? um, it was rolled out when my brother went to the Philippine General Hospital in Manila, right? um, so cancer as a disease is really it's a family disease, like in a way that the family is really involved. So the support system is just really demanding, right? It is emotionally, sometimes morally and financially draining, right? But with the help of our friends and relatives, and we're very thankful to them, and um, we're just really lucky to have them, and thank God for all those people who are continuously helping us go through this journey with my brother. So my brother went through several chemotherapies already. Started with um, the induction chemotherapy. So after the induction chemotherapy, um, it's a 7 day session, right? And then a 1 month hospitalization. So after that, we're expecting it to be remission, but then turned out that there were like there was like more than 10% of cancer blasts in his bone marrow. So he had to go through reinduction chemotherapy. After the reinduction chemotherapy, um, so it turned out that the cancer blast decreased to less than 1%. So doctor advised for remission. So remission means that the cancer blast is already below 1%. So he went through. He should go through three remission chemotherapy. So he finished two, but on the second one, the result turned out to be 14%. So it meant that the cancer came back. So it was a relapse. So he went through reinduction chemotherapy again. We had to source out the medicine from India. We had to wait for the shipment for about 2 weeks or 3 weeks, and the scheduling in the Philippine General Hospital. So this month he already went through the reinduction chemotherapy, and turned out that the drug did not um, it was not as effective as we expected it to be in the cancer blasts. After the bone marrow test turned out to be 40% already. So there are two options left for him. So One is a risky, very high risk um, procedure. So the doctor had been very transparent when it comes to the procedure that my brother will be going through. So she said that it's risky. Some patients, or most patients, would not usually survive the effect of the medicine. So the other one is like an outpatient treatment. It's sort like it's just like the kidney dialysis. So it will be a lifetime um, um, treatment that would lengthen his life and then control the cancer cells, if not eradicate. So it's not that effective as per the doctor. Um, so there. Uh, so we've been already thinking of, having the herbal medicine and everything. So he suggested my brother to take. He already tried sambo. He already tried before the papaya leaf. And then now he'll be trying the guyabano leaf tea. So it's just like the air dried guyabano leaf. As I've read through the internet, it's very effective fighting cancer and several other things in the body. So I've also been drinking guyabano for the last since last year. So I use it as a tea in the morning. So that's what he's gonna try, and we really hope and pray that you will continuously support my brother in this journey to fight this disease. We are asking for your help, and you know and I know my brother can do this. He's been through a lot already this year, and I know that he can. I know I trust God, and I have these hopes that miracle will happen. Right? Yeah. So my brother is currently in the hospital, and maybe he'll be out maybe tomorrow or the next day. They're just waiting for him to improve his platelet counts, so he'll be able to go out. Please pray for us. So because basically those are the things that someone's gonna go through when you have leukemia. So I cannot imagine the pain. I don't know if it's excruciating. So my brother has already lost weight significantly, but he's still eating well, and I'm happy that his mindset is still as strong as before, and because he knows that a lot of people is fighting with him, and we're just praying, fervently praying that everything will be fine, right? And as Christmas approaches, that's the only thing that I'm actually wishing. Thank you so much for your help and your continued support. To visit my brother's page, you can see that below on the description, at Help Arvin Fight AML Facebook page. We'll be posting some more videos as we go along regarding my brother's condition. Thank you, and have a nice evening. Thank you, and have a nice evening.